Hey, I'm Dr. Kelvin. Actually, I want this video to feel like a conversation between friends, from someone who has already dealt with the same problem that made you click on this video. In other words, I've had tendonitis, I've had bursitis in my shoulder. I'm going to explain everything I did to treat this problem. Today, I don't have any more pain, and how to treat it without needing anti-inflammatories, which only come with side effects, without the need for invasive surgery, okay? I'm going to show you how I treated my shoulder and how you can treat that pain that's bothering you right now. If you follow the step-by-step instructions in this video, I injured my shoulder when I was 16 at the gym. I spent years and years in pain, trying to find doctors, trying alternative treatments. I just couldn't find a solution to this problem. No one could help me. That's when, in college, I started studying this subject. I started diving deep into orthopedic books and articles, and I began applying what I learned to myself, and that's how I treated my shoulder pain. I'm going to share all these tips and also exercises with you. There are exercises in this video. Stick around until the end so you can check it all out. So don't leave this video. Stay until the end so you don't miss any information, because I really put my whole heart into this video for you. Shoulder pain usually happens because of compression of the bursa, or the tendon that's inside the shoulder joint capsule. We call this problem bursitis, tendonitis, or impingement syndrome. Here's a simple test you can do at home to find out if you have this issue. Make a thumbs up and repeat this movement with me, but with your thumb pointing down. Now raise your arm all the way up and see if you feel any pain. If you do, make a note of that. Now repeat the movement, but this time with your palm facing up. Tell me, did it get better? If it hurt during the first movement and got better during the second, that's a positive sign for shoulder impingement syndrome. If you felt any pain during this test, stretching as well as strengthening. The muscles here in the shoulder are essential because it helps stabilize the shoulder inside the joint capsule. A lot of people ask me, Doctor, what's the best medicine for shoulder pain? My answer is always the same. Pills don't stretch. Pills don't strengthen. The best remedy to treat shoulder pain is exercise. That's right. If there's one thing I learned when I had shoulder pain, it's that pills are useless. Anti-inflammatory medication, injections, electrical stimulation, compresses, none of that matters if we don't address the main component, which is strengthening the shoulder muscles. Strengthening, especially of the rotator cuff, which is a group of muscles that help stabilize the shoulder within the joint capsule. We call it the rotator cuff because it resembles the sleeve of a t-shirt, and rotator because it produces rotational movement. Rotation outward, which we call external rotation, and rotation inward, which we call internal rotation. So basically, these are the two main movements we do to strengthen the rotator cuff. The last two exercises I'm going to show you are specifically to strengthen the rotator cuff. But there are a few others, so that's why you need to stick around until the end of this video, because there are some others I need to show you before those. For example, this one, exercise number 1, where you might feel a decompression and almost immediate relief from your shoulder pain. For this, you're going to place your hands on a support surface, like a table, on your windowsill at home, or a stool, like the one I'm using here. And now you're going to push down on that support surface, pressing it toward the floor. Really pressing your hand down, and look, moving your pelvis back, while you also take a few steps back, doing this for about 15 repetitions. So you move your hips back, walk forward again, and count 1 repetition. Move your hips back again, without letting go of the pressure from your hand. Always keeping that force, pushing the support surface down. Come back and count your 2nd repetition. Once again, hold it, move your pelvis back. Take a few steps back, return, and count 3 repetitions. Repeat this movement until you reach 15 repetitions. Exercise number 2. This exercise is not only for people with shoulder pain, but also for those who have that posture, those shoulders that roll forward. I'm almost certain that if you have shoulder pain, you probably have your shoulders slouched forward. This not only makes your posture worse, leaving you with poor posture, it also contributes to increased shoulder pain because it increases compression here in the shoulder. So if you have shoulder pain and your posture is hunched like this, you need to start paying attention to yourself. Roll your shoulders back a bit, push your chest forward, and correct your posture, okay? Because this will really help to improve your shoulder pain. There's a stretch I'm going to teach you to loosen up these muscles here that are pulling your shoulders forward. Take a look. For this, find a door frame in your house and stretch your chest. So place one arm on each side of the door frame, move your body forward, pushing your chest out. And do this exercise for 3 sets of 60 seconds each. When you finish this exercise, keep that posture I taught you. In other words, keep your shoulders rolled back and your chest forward. because this will really relieve your shoulder pain and, as a bonus, improve your posture. Exercise number 3. This is the exercise that subscribers call the miracle exercise in the comments of the previous video. For this, kneel down slowly on the floor and get into a hands and knees position. I'm going to break this exercise into 2 parts so you can understand it better. In the first part of the exercise, you're going to do it without bending your elbows. You will bring your torso closer to the floor, feeling the space between your shoulder blades get smaller. But pay attention, do this without bending your elbows. In the second part, you push the floor away, meaning you move your torso away from the floor, and feeling that space between your shoulder blades increase. And again, let me remind you that you should do this without bending your elbows. With this exercise, you're strengthening the serratus anterior muscle, which is an important scapular stabilizer. By doing this, you improve the strength and stability of your shoulder, reducing pain. Do this exercise for at least 3 sets of 10 repetitions. A variation for those of you who can't kneel is to do this exercise standing up with a ball of any size. Then you push the ball against the wall. But look, pay attention. This time it's not your torso that's going to move. It's just your shoulder that moves, forward and back, forward and back. And again, let me remind you that you shouldn't bend your elbows during this exercise. This exercise can also be done in 3 sets of 10 repetitions. So make sure to save this video somewhere so you can come back here every day and do these exercises with me. And don't forget to give it a thumbs up and subscribe to the channel. We're aiming to reach 100,000 subscribers, so I'm counting on your help. Subscribe to the channel. Exercise number 4. There's a book by a shoulder surgeon where he says he cured 99% of his patients with shoulder pain using this exercise protocol right here. It's a protocol of 1 minute per day of passive hanging. The thing here is that, besides decompressing your spine, MRI scans have shown that there's a reorganization, a remodeling of the shoulder, of the structures in your shoulder into their natural position. If you have impingement syndrome or a positive sign on that test I showed at the beginning of the video, this exercise might cause you quite a bit of pain. If it hurts, you're going to do it differently. Instead of hanging with your whole body, you're going to hold the bar a little lower and squat down with your feet still touching the ground. By doing this, you take some of the weight off. If even with the second option you still feel pain, you should stop this exercise and move on to the next ones. Exercise number 5. Now we're going to start strengthening the rotator cuff muscles. Those are the muscles I mentioned that, when you strengthen them, help stabilize your shoulder inside the joint capsule. By doing this, you'll feel more secure when doing other exercises, exerting yourself, or even performing repetitive movements. For this, you need a resistance band like this one, and you should attach it somewhere in your house, where it stays about at the level of your belly button, like for example, the latch on your door. Or if you go to a gym, you can do it there, using a resistance band from the gym or even with a cable machine. Place a pillow or mat under your arm because studies show that in this position, your shoulder is more secure. And then you pull the band from your belly button outward, just like you're seeing in the video. Hold this contraction now for 5 seconds to engage the fibers responsible for stabilizing the shoulder, and then return. Do another repetition. Count 5 seconds, 1, 2, 3, 4, 5, and return. One more time, 1, 2, 3, 4, 5, and return. Do this exercise for 3 sets of 10 repetitions on each side. I don't even need to say that you need to do this exercise with both arms, otherwise the other shoulder that was left out will get jealous and start hurting just to get your attention. These exercises can also be done with internal rotation, meaning you start from the outside and move inward. Also doing 3 sets of 10 repetitions on each side. Exercise number 6. For this exercise, we're going to open up and do a shoulder abduction. So you pull the band upward. Hold for 5 seconds, 1, 2, 3, 4, 5, and return. Pull the band up, 1, 2, 3, 4, 5, and return. Also do this exercise in 3 sets of 10 repetitions, holding the muscle contraction for 5 seconds each time. Alright? But how do you avoid another shoulder injury? By doing these exercises at least every other day, 3 times a week. In 1 to 3 months, you'll notice that your shoulder pain will improve a lot. But here's the thing. After that pain gets better, you'll want to avoid new shoulder injuries. You won't want to go through all of this again. About the shoulder injury I had back when I was 16, which I've already told you about. I got that injury because I went to the gym to work out, and I didn't warm up before exercising, so I got to the gym with my shoulder cold. The first thing I did was lie down on the bench, load up the bar with weights, and I started bench pressing with a cold shoulder without warming up. On the very first set, I felt a pop in my shoulder, That's when I got that injury. For those of you who go to the gym, pay attention, you can't do any weighted exercise without warming up your body first. Your shoulder, knee, and elbow joints. If you do weighted exercises without warming up, the risk of injury is huge. At the gym, you can pull up this video on your phone and repeat exercises 4, 5, and 6. By doing that, you'll warm up the muscles in your shoulder, and then you can start your exercise sets, doing these weighted exercises much more safely. Another question my patients have is this: Doctor, how long do I have to keep doing these exercises for my shoulder pain? And I always answer that when you have an injury like this, you should do these exercises for the rest of your life. The patient is shocked, right? My God, how absurd. How am I going to exercise for the rest of my life? Are you crazy, doctor? You have to live your life and all that. I answer like this: look, you brush your teeth every day. At least I hope you do. If you don't brush your teeth every day, you'll have problems in the future. It's the same thing with these exercises for people who have shoulder pain. Do them regularly, at least every other day, at least 3 times a week. Because if you don't, if you slack off on these exercises, sooner or later, your pain might come back. I'm actually a pretty active guy myself, but I've been out of the gym for 4 weeks now because of a surgery. I had an accident with my hand and had to have surgery. And the shoulder pain, since it's been quite a while since I've done these exercises, the shoulder pain has started to show signs of wanting to come back. So there's no point in just doing these exercises from the video once to try them out, and then disappearing and never doing them again. You need to do them, like I already suggested to you, at least 3 times a week. And then, in the long run, you'll see that the shoulder pain will get better. Just like there are exercises, like exercise number 3 from that comment you read, that can give you instant relief from shoulder pain. But what will really protect your shoulder is mainly strengthening your rotator cuff. Another tip I have for you is that you replace those anti-inflammatory medications that only have side effects and are bad for your stomach and kidneys. Replace those anti-inflammatory drugs with a natural anti-inflammatory, which I always emphasize in my videos, and that's turmeric, also known as curcuma or ground turmeric. Turmeric is a powerful natural anti-inflammatory that doesn't have the side effects. Studies show that when compared to anti-inflammatory pills, the ones with side effects, turmeric without those side effects actually proves to be more effective when taken 3 times a day. If you've had an X-ray or MRI and found out that you also have some degree of osteoarthritis in your shoulder, other supplements like creatine itself, vitamin D, omega-3, and magnesium also help as natural anti-inflammatories. In cases of osteoarthritis, they're really helpful for it. I already have videos here on the channel about which supplements I prescribe for osteoarthritis, so check out that video later. Another powerful anti-inflammatory is ice itself. Just this week, someone asked me, Doctor, what's the best compress for shoulder pain, a hot compress or an ice pack? And actually, the answer is that it depends on the stage of the pain. If the pain is recent, caused by an injury or inflammation, ice can be better during the first 48 hours. Or if you did some strenuous exercise and noticed that the next day, the pain you had got worse, if you felt that your shoulder is hot, burning, or has a burning sensation, you can also use ice. Now, if the pain is chronic, if there's arthritis involved, or you're already in the recovery phase, in that case, heat can help more because it helps relax the muscles and promotes better circulation. But remember that every case is unique. None of these tips are universal, and this video is not a substitute for seeing a specialist. If your pain doesn't improve with these tips, you need to seek out a trusted professional. And if this shoulder pain bothers you at night, if you wake up in the middle of the night or the next day with shoulder pain, here's my tip for you. Try to lie on the less painful side. If you have pain in both shoulders, then lie on the side that hurts less. If only one shoulder hurts, lie on the side that doesn't hurt. And here's the thing. For the painful side, take a soft pillow or cushion and gently rest your shoulder on that pillow with your shoulder facing up. There are some sleeping positions that are not recommended for people who have shoulder pain. If you wake up with shoulder pain, it could be that you are sleeping in that position. And with that in mind, I recorded a video about the positions that are not recommended for people who have shoulder pain. To watch it, just click on this square. I'll see you there.